Hi, I'm Sheryl Buckner, and I'm presenting on behalf of our interprofessional group, Doctors Robertson and Maisano, and Sharon Vasquez from the College of Nursing, Dr. Ibay from the College of Public Health, Professors Kendrick and Fritz from the School of Social Work, and Kathy Pierce from OU Health. This simulation was initially developed as we found that in graduate school, administrative students do not always work together on common issues that are likely to occur in a healthcare system. However, as soon as they graduate and are hired into these executive roles, they are expected to work together with these other professions, possibly never having done so before. The simulation was developed to mimic real life situations. The involvement of a senior leader from OU Health helped to ensure that the simulation scenario was realistic, challenging, and appropriate for executive level leaders. We further developed a simulation we initiated last year, the Interprofessional Leadership Simulation for graduate nursing, social work, and public health students. Students were able to practice leadership skills, including IPEC competencies, in a virtual setting. Using D2L as a platform, they prepared for the simulation and were given information to review and were asked to complete baseline competency assessments. They were assigned a senior leadership role, given a position description, given background information about the hospital, given hospital policies and procedures, and an organizational chart. The simulation involved an interprofessional team facing an urgent and complex challenge or crisis that occurred in a fictitious healthcare setting. The scenario was designed to provide participants opportunities to practice a variety of skills, such as teamwork, communication, problem solving, and innovation. During the simulation, various hospital employees and or embedded participants interacted with them online, giving them updates on the crisis. In addition, students could call these employees with any questions they might have. Students could access various policies and procedures from the fictitious facility during the simulation. They had about 2 hours to resolve the crisis and develop a written plan. They presented their plan to the mock hospital CEO, who then gave them feedback. Post simulation, they completed competency assessments and simulation evaluations. From the Jefferson Reflection Survey, students reported qualitatively how they felt about this simulation in relation to interprofessional practice. Students involved in the simulation experience said it made them feel more positive about interprofessional practice, more confident in handling serious healthcare events, and helped them understand and identify weaknesses. They also reported that this simulation demonstrated the importance of knowing your role, valuing others' expertise, and delegation. Students said that participating in the simulation helped them and made them more comfortable with interprofessional collaboration. In addition, they gained a better perspective about why interprofessional care is important and that looking at care from multiple perspectives in turn creates higher quality care delivered to the patient. Students commented that the realism of the scenario enhanced their learning experience. They also commented that the time invested in the simulation was worthwhile and added to their learning. In addition, we asked students to complete the Jefferson Teamwork Observation Guide, where students indicated a high level of positive teamwork behaviors throughout the simulation. Some examples of how they demonstrated IPEC competencies and how they evaluated them are as follows. For roles and responsibilities, students were placed in groups of 4 to 5, and each student in the group was given a unique role and role description that they played during the simulation. By the end of the simulation, they realized how important each role was in order to make a written plan together. They rated this item on the Jefferson Teamwork Observation Guide Team members seemed to understand roles and responsibilities of other members of the team. They rated this very highly. For teams and teamwork, students were put in a virtual team and had to work together to solve a healthcare crisis. They also had to develop a plan related to resolving that crisis and present that plan as a team to the hospital CEO. They rated this item on the Jefferson Teamwork Observation Guide. Team members sought out opportunities to work with others on specific tasks very highly. For values and ethics, besides being given research in their pre work about how knowing your role is important, they were also reminded in pre work about how values and ethics may be different for the professions and how this plays into realizing how different professions view events differently based on these values and ethics. They rated this item. The opinions of team members were valued by the other members very highly. And on communication, during the sim, students worked together using verbal and nonverbal communication with each other and mock hospital employees. They rated this item, discussion was distributed among all team members, very highly. We thought this comment from a student summarized this activity overall the best. I've always believed interprofessional collaboration was crucial for students to gain the most out of learning, but today's activity really reemphasized that. I believe now, more than ever, that interprofessional engagement, such as this one, should be required for all students. Working together as a group is essential for each of our professions, and being able to learn from one another will only help deepen our knowledge in our practice. I believe this exercise brought me confidence in my skills as a future administrator and gave me a newfound appreciation for all healthcare professions. Currently, we are analyzing data from the Jefferson Reflection Survey, the Jefferson Teamwork Observation Guide, and the Interprofessional Attitude Scale. We then plan to develop manuscripts and publish. We are also planning for a repeat of the simulation for the fall for this group, and we look forward to exploring how we can expand this to include other professions. We will take questions live afterwards, or if you want to contact us, here's an email. If you have a program that you think would like to collaborate on this in the future, please let us know.